Today's drug is Benazepril, brand name Lotensin. The pharmacologic and therapeutic class is that it's an antihypertensive and an angiotensin converting enzyme inhibitor. Dosage form and strength. The medication comes as a tablet in a 5 mg, 10 mg, 20 mg, and 40 mg strength. Indication and dosing for adults. The main indication for amlodipine is to treat hypertension. The treatment range is between 10 and 40 mg per day, with the doses divided into 1 to 2 doses per day. When initiating, start at 10 mg by mouth every day with a max dose of 80 mg per day. If the patient is on a diuretic, initiate at a lower dose of 5 mg by mouth every day. An off-label use for amlodipine is in heart failure. The treatment range is between 5 and 20 mg by mouth every day. Initiate at 5 mg by mouth every day with a max of 20 mg per day. Indications and dosing for pediatrics 6 years of age and older. The main indication is for hypertension. The treatment weight-based dosing range is between 0.1 and 0.6 mg per kilogram per dose every day. When initiating, start at 0.2 mg per kilogram per dose by mouth every day up to 10 mg per day. The max is 0.6 mg per kilogram per day up to 40 mg per day. Mechanism of action and pharmacology. Amlodipine competitively inhibits the angiotensin 1 converting enzyme. The inhibition of the enzyme prevents the conversion of angiotensin 1 to angiotensin 2, which is a potent vasoconstrictor. The decrease of angiotensin 2 also increases renin activity and reduces the secretion of aldosterone. The absorption is rapid at 37% with minimal changes if taken with or without food. The medication is rapidly hepatically metabolized to the active metabolite. 20% is excreted through the urine as an active metabolite and 12% as other metabolites. Regarding the onset of action, the peak effect occurs within 1 to 2 hours after a 2 to 20 mg dose. The time to peak of the parent drug is between 0.5 and 1 hours, and the active metabolite is between 1 to 2 hours if fasting and 2 to 4 hours when non-fasting. The duration of action regarding the reduction of the ACE activity is 24 hours, with greater than 90% of the ACE activity halted after a 5 to 20 mg dose. Half-life elimination for the drug is around 5 hours in children and 22 hours in adults. The active metabolite is 10 to 11 hours. The drug and active metabolite is around 95 to 97% protein bound. Special populations and considerations. In African Americans, there is a decreased efficacy when used as monotherapy. In renal impairment, if the creatinine clearance is less than 30, or if the patient is on hemodialysis, initiate at 5 mg every day with a max of 40 mg per day. In patients with hepatic impairment, no adjustments are needed. In the elderly, consider lower doses. Regarding contraindications or times to exercise caution is in patients with a history of angioedema from ACE inhibitors, in African Americans, in renal impairment, in severe CHF, in CAD, and many others. Regarding pregnancy, it is best to avoid the use. There is risk of fetal and neonatal harm or death in the 2nd and 3rd trimester. Regarding lactation, there is no known risks or harms based on the limited data out there. Side effects. Some common side effects are cough, fatigue, dizziness, hypotension, hyperkalemia, increased BUN or creatinine, photosensitivity, and hyperuricemia. Some serious side effects are angioedema in the head, neck, and intestine, severe hyperkalemia or hypotension, agranulocytosis, neutropenia, Stevens-Johnson syndrome, renal impairment and failure, as well as others. There is a black box warning for fetal toxicity. Discontinue Benazepril as soon as possible if pregnancy is detected. Drug interactions. Some characteristics to consider are angioedema, antihypertensive agents, decreased renal activity, hyperkalemia, hypoglycemia, and hyponatremia. Some drugs to avoid are clonidine, tacrolimus, telmisartan, valsartan, as well as guanfacine. Some drugs to monitor or modify treatment on are almotriptan, acyclovir, amphetamines, aripiprazole, and clozapine, as well as others. Monitoring parameters. Monitor blood pressure, BUN, creatinine, electrolytes, and white blood cell counts if the patient is renally impaired. Patient counseling information. Benazepril is commonly used to treat high blood pressure in children and adults. It has off-label uses in heart failure for adults. It should not be used if the patient is pregnant and must be discontinued as soon as possible if pregnancy is determined. Wait 36 hours before taking if the patient has been on Entresto or medications that contain sacubitril. Drink plenty of water when on Benazepril, and if a dose is missed, skip the dose if it is almost time for the next dose. Do not use potassium supplements or salt substitutes unless specifically instructed by an MD to do so. After sitting down or lying down for a period of time, avoid getting up too fast to avoid orthostatic hypotension.